Close to Home, a personal look at the opioid epidemic in Iowa.
We are a 2-year-old nonprofit organization that provides drug user health services in Iowa City, Cedar Rapids, Des Moines, and a number of rural communities across the state of Iowa. We're also an advocacy organization that has a presence at the state capitol and works to influence policy change through the state legislature. So in the last 2 years, we've had two really big achievements, and one has been creating a really robust naloxone distribution program for the state. Naloxone, also known as Narcan, is the medication that reverses an opioid overdose. It's sort of a magic bullet that revives people when they've overdosed on heroin or a prescription opiate. And to date, we've distributed over 15,000 doses of naloxone to Iowans. And we know that just about 4,000 unique people have received that naloxone. We also target our naloxone program so that we just distribute naloxone to people who are most likely to be the folks who will use naloxone, drug users themselves. And so in our program, we to date have had 779 people come and tell us that they used our naloxone to save a life. The other achievement that I'm really proud of that our organization has done is to look at the opioid crisis as a complex phenomenon that doesn't just involve substance use and overdose deaths, but also has created a wave of new infectious disease outbreaks in our country. And so Iowa Harm Reduction Coalition does a really intensive work to prevent the spread of hepatitis C and to provide people with treatment. And last fall, the Iowa Department of Public Health credited our organization with a 13% decrease in hepatitis C rates between 2016 and 2017 in the state. In the work that Iowa Harm Reduction Coalition does with people who use drugs, we meet a lot of people who are actively using, but then we stick with them. We meet people where they're at, but we don't leave them there. We hold their hand and walk with them through whatever process that they're on. And so for a lot of people, over time they develop an interest in changing their relationship to the substance they use and pursuing treatment for an opioid use disorder or for a dependency on heroin. And so we have developed partnerships with methadone clinics around the state and with providers of Suboxone and with other treatment centers too, so that we can link people right into treatment. So we know that when our participants engage in MAT programs, they're less likely to relapse, they're less likely to go through a period of sobriety and then begin using again, and that makes them less likely to experience an overdose and die. We also know that people who have long-term chronic opiate use have experienced structural and biochemical changes in how their brains function. And so people with opiate use disorders have fundamentally altered brains in some cases. And so that means not everybody can live a life without the presence of any opioid receptor agonist or antagonist for the rest of their time. I think in the past 10 to 20 years, the perception of methadone clinics has evolved dramatically, and I think it's rooted in two different things. One is that methadone clinics themselves have changed really dramatically, whereas initially they may have struggled financially and provided a service of just taking your daily dose and getting people in and out the door. Now with expanded federal funding to address the overdose and opioid crises, they've really evolved into centers that can provide comprehensive health care and work with people to drive on a path towards wellness with them in ways that are more holistic rather than just providing a medication. That's it and that's all. But the other thing I think has changed the face of what methadone clinics are is the shift in the color of the skin of people who use drugs. And so we know that the methadone clinic in our history as a country is pictured as a place where people of color go to receive their dose of methadone because heroin was a drug that was primarily associated with communities of color. Whereas now, methadone clinics, when you go into any methadone clinic, There's people from all socioeconomic backgrounds, people with all skin colors. It really is about just keeping people alive. And while that goal might sound sad or it might sound simplistic, you can't achieve any other goals that someone has for their life without just ensuring their day-to-day survival. And for people who use drugs, that is what so much of your existence becomes about, is just surviving through another day. It can be hard to understand as a frame of reference for a living, but we have to make sure that that's our first goal when we work with people and we think about how to transform our communities, is just that people stay alive first and foremost.